Hi, everybody. Welcome to the webinar. We're just waiting for folks to come into the room. It's great to see those participant numbers going up and up. We'll get started in just a moment. You're in the right place if you're looking for the UHC Day campaign launch for 2025. Great to see you all joining. Please do, as you're coming into the room and as we're getting ready to get started, introduce yourself in the chat. Tell us where you're joining from. It's always exciting to see our global audience for these kinds of events. And I think we're going to go ahead in the interest of time and get started. So thanks again. Oh, fantastic to see the countries you are representing. Thanks again for joining us for today's launch of the 2025 UHC Day campaign. It's fantastic to see you as we start preparations for the lead up to International Universal Health Coverage Day on the 12th of December. My name is Amy Baldasser-Bush, and I have the pleasure of being your moderator for today's session. I'm a Senior Director for Health Policy, Advocacy, and Engagement at Management Sciences for Health. And together with my colleagues at Management Sciences for Health and Wacky Health, I also oversee the work of the Civil Society Engagement Mechanism for UHC 2030, which is the civil society constituency of the global multi-stakeholder partnership to build stronger health systems and advance universal health coverage. The CSEM, as we call it, and our 1,600 member organizations in more than 130 countries around the world advocate to ensure UHC policies are inclusive and equitable and that no one is left behind on the road to achieving UHC. And we're going to talk about involving you in that advocacy today. So on behalf of today's organizers, UHC 2030, the CSEM, and the Coalition of Partnerships for UHC and Global Health, thank you for your commitment to advocating for health for all. Before we begin, a few logistics and reminders about how today's webinar is going to work. The webinar is being recorded, and we're pleased to offer simultaneous interpretation in English, French, Spanish, and International Sign Language, as well as access to closed captioning. Thank you in advance to our fantastic interpreters. So all participants, there are some instructions for you here on the screen, can select their preferred language by clicking the globe icon at the bottom of your screen. When you do so, you'll see the option to choose the channel you want to listen to and to mute the original audio if it's distracting you from hearing your language of choice. Everyone needs to select a language to ensure you're able to listen to all our speakers. If you need any technical support, reach out to my colleagues in the chat. In addition, you can also select whether you'd like to read the captions. You'll see a button, an icon with 2 C's on it. You can use that to access the captions. They are automatically generated in Zoom, so there may be some errors, and unfortunately, they're only available in English at this time. So please use the chat box. I'm really excited to see all of you introducing yourselves if you need any support during the call. So let's get into it. Let's learn a little bit more about this year's campaign with the teaser video. I'm going to ask my colleague to roll the video, and then we'll get into looking at the full agenda for today, which includes some really exciting resources as well as some important reflections from our advocacy partners. Dramatic message and dramatic music. Thanks to my colleagues for making the tech work today. So, as all of you know, this year's International Universal Health Coverage Day on December 12th comes at a really critical moment to continue our advocacy and build momentum for the work on health for all. With cuts to development assistance and polycrisis from climate to conflict, we know that our mantra of ensuring that no one is left behind on the road to UHC is facing many challenges. As you may know, there will also be another United Nations high-level meeting on universal health coverage in 2027. So it's a crucial moment to call for accountability for those commitments that have already been made to achieve UHC. Our campaign launch today is to help empower you, advocates, civil society, UHC champions, with tools and messaging you can use to influence decision makers, from heads of state and ministers of finance and health to parliamentarians and local authorities, to guarantee access to a core package of essential, high quality, and affordable health services. That's really what UHC is about, right? All people having access to the full range of quality health services they need, when and where they need them, without financial hardship. So during today's webinar, as you can see on the screen, we'll have the reveal of this year's theme. You just got a preview in the video from our UHC 2030 co-chair, Dr. Pamela Cipriano. We'll unveil all of the multilingual tools, graphics, messages, social media templates to help you drive mobilization around UHC Day. We'll be joined by some expert panelists to discuss why financial protection is essential to making real progress towards UHC, and they're going to share some stories of how they connect lived experience and data to decision-making and advocacy. We'll save some time for dialogue with all of you. Please feel free to submit questions in the chat box at any time. And we'll wrap up with some concrete actions you can take starting today. You don't have to wait for December 12th to make progress on your advocacy around UHC Day and our focus on financial protection for health. So to get started, it's my pleasure to welcome our UHC 2030 co-chair and the immediate past president of the International Council of Nurses, Dr. Pamela Cipriano, to deliver the keynote remarks and kick off today's campaign launch. Pam, over to you.
Thanks so much, Amy. Appreciate those introductory remarks. And it is truly my pleasure to join you for the launch of the 2025 UHC Day campaign. As you heard Amy mention, this is a really unusual time. The global context is marked by rising conflicts, severe challenges in health financing, widening inequality, climate shocks, and pressure on all health systems. But, amid this disruption, I think there is also room for optimism to turn these pressures into action and strengthen health systems, which we always focus on. How can we help increase equity? How can we make sure that there is justice and inclusion? And it's time that we are delivering results that truly don't leave anyone behind. And so maintaining momentum for UHC 2030 achievement is really critical, as well as accelerating action. So we want all of us to come together to be sure that we're acting decisively and challenging the status quo. We have to accelerate the progress on UHC so that everyone can access the care that they need when they need it without financial hardship. We're seeing progress, but we need to scale up those efforts. So we're going to continue to focus on why the human price of unaffordable health costs must be addressed. As you know, over half the world's population, about 4.5 billion people, still lack access to essential health services. We also know that 2 billion people are experiencing financial hardship in accessing health services because they have to pay out of pocket for a number of reasons for their health care. I've seen the impact of these situations and statistics on communities. For many years, I think people believe that everyone in the United States gets health care. Well, that's not the case. We have a lot of pockets of poverty where individuals just can't get care. For many years, I was involved in a leadership role at my university and health system to make sure that we had many volunteers that participated in what's called remote area medical clinics. Now, they actually are operating around the world, but it's important to note again that these are absolutely critical ways to deliver care. Individuals sleep in their cars from midnight, the night before our clinic is going to open, and wait for healthcare in the morning to start up at 6 a.m. This is the one time of the year they're able to access healthcare. And people in the US, a lot of times, like many other countries, can't afford insurance. They have poor coverage. The plans are not comprehensive. They live in remote or underserved areas, and our systems are very complex to navigate. So on these days that they can come for free care, they get vision care, dental care, a lot of medical care, diagnostics. And what was so striking to me that really brought this message home many years ago is that the number one service that people got was pulling teeth. Now, who would believe that that was one of the most essential ingredients to healthcare? But if you can't eat, can't see, if you don't get diagnosed early, you have very severe disease, because we would find many advanced cancers. This is just not the way people should live, in fear of not being able to have health care. So these challenges don't affect everyone equally, with the most vulnerable and those living through conflict and emergencies carrying the heaviest burden, facing compounding health and financial risks. So we have to make progress toward UHC, or we know people will continue to be pushed further into poverty. And poverty is in and of itself a very cruel condition. So that's why the UHC Day campaign theme is really critical. And as you've almost heard the whole statement on our slides here, unaffordable health costs, we are sick of it. So this is a time we have to make the impact with this messaging. Our 2025 campaign continues to build on the focus on financial protection. We want to keep up pressure on our governments, who are our colleagues, to turn their UHC commitments into action. We know that they know how to do it, but they have to be bold to execute. So we're reminding world leaders this year that behind every one of these statistics is a valuable human story and human life. With our campaign pushing decision makers to take immediate and tangible action, we want them to uphold the right to health for all. It is a belief that we all hold dear, that we must be ensuring health as a human right. So we have a call to action at all levels. We want to start with the global level. So we want to be able to confront the structural constraints, including debt service obligations, which is causing debt distress, as you know. So the government struggling with fiscal space pressures can invest in health. We have to change the mindset of cost to investment. And we want to be sure that it starts with political will. You'll remember several years ago, as we began our action planning, political will was at the top of that list. We continue to hear that over and over, to be able to work with our government leaders to make sure that we have inclusive governance, stronger accountability, better essential benefit plans, and a commitment to equity. As SDG advocates and UHC advocates, you are critical to this campaign, and by spreading awareness, amplifying the messages and the human stories behind these statistics. We need to mobilize our governments and decision makers to protect people from the impoverishing health effects of the health costs. Again, as we continue to stress, and you're hearing from messages at the grassroots level, people shouldn't have to choose between food and essential care, housing and essential care, protections that are just inherent in protecting human life. So let me conclude by saying, at the heart of UHC are individuals, families, and communities. I mean, this is the foundation of our societies, of our health security, of our national securities, and our economic security. There are solutions. We're hearing from many countries that they've shown progress, from things like implementing taxes on health-harming products, to insurance scheme reforms, to extending coverage, especially for preventive care, and looking at who is in their population. So we want to be able to help governments look at ways to reduce costs in the long term, not just for the government, but for individuals. By protecting people from the burden of unaffordable health costs, we not only uphold the right to health, but we also strengthen the foundation of our societies. And this is why your participation is absolutely critical. And we hope you'll take the tools that we'll be discussing today and the great messages that you'll hear from our panelists and parlay that into action in your area. Amy, back to you.
Thanks, Pam. Thanks for that great kickoff. As an advocate, some of the things you said, justice and inclusion and challenging the status quo are my favorite things to do. And that's partly what we're setting out to address on this UHC Day. So you've heard from Pam a little bit about the campaign slogan. I'm really delighted now to invite Paloma de la Cruz from the UHC 2030 Secretariat to walk us through all of the tools and resources that have been created for your use in this year's UHC Day campaign. Thanks, Paloma, for all your hard work, and over to you.
Thank you so much, Amy. And hi, everybody. My name is Paloma de la Cruz. I'm a communications consultant with UHC 2030 and a part of the UHC Day Secretariat. It's my pleasure to be here today to share this year's campaign messaging and tools with you. As Dr. Cipriano mentioned, more than half of the world's population still lacks access to essential health services, and a quarter of them face financial hardship when paying for healthcare out of their own pockets, often at the expense of food, education, or housing. So this year's slogan, which you see on our backgrounds here, and the messaging focus on sharing the stories and lived experiences behind the data to remind leaders that these aren't just statistics, they're human lives we're talking about. The tone is one of impatience and urgency, showing decision makers that we're fed up with the current state of things, but also that when people have to miss out on or delay care due to costs, they risk getting sicker or developing longer-term illness. On the other hand, when leaders prioritize people's health, they lay the groundwork for sustainable progress across all sectors. So the campaign calls on country leaders and development actors to prioritize high-impact investments that strengthen community resilience and drive economic prosperity. I'll now walk you through the microsite in the toolkit, which we have organized into simple steps that advocates can take to engage with the campaign. I'm going to share my screen. Okay, so this is the, turn my video back on. This is the landing page for the UHC Day microsite, which you can access at uhcday.org. For the moment, it just has a promotion of today's event. There's an About tab with some background about UHC Day and how it is coordinated. And this is the juicy part. This is where you can access all of the tools and messaging for this year's campaign. As I mentioned, it's set up into 5 simple steps that advocates can take to engage this year. You can either jump to the step you're interested in using this menu up here, or you can scroll through in sequential order, which is what I'll do now for the purposes of this presentation. All of these visuals are available in additional languages, which you can access through these buttons here. So the first step to engage with this year's UHC Day campaign is to spread the word. This section provides the visuals and the text for social media. As Amy mentioned, the goal is to challenge the status quo, to emphasize that it is not normal to have to miss out on or delay healthcare because of the costs. Here, you can access and download the campaign images as well as suggested posts to use on your social media platforms. And you can promote them as is, or you can make them your own. This is your tool, so please adapt it as you see fit. The second section and the second step is to spread the word. To tell your story. This section focuses on people's lived experiences. It's an invitation for you to share your story in a short video as part of the ongoing Health Costs Hurt campaign. This is a campaign that aims to show the impact of health costs on people's lives, and it's a key way to engage in UHC advocacy year-round beyond UHC Day. So you can click on this button to learn more about the campaign, and at the end of my presentation, we'll share a few examples of videos that have already been submitted for your inspiration. This section will also include a customizable graphic, which will be available in the coming weeks. So please stay tuned. The third step is call for change. This section provides calls to action for the campaign with clear steps that government decision makers can take to turn commitments into action and to protect the fundamental right to health. It includes a suite of images, which you can download individually or as a carousel, as well as links to a series of templates here a letter template to write to decision makers, a statement template to speak up in meetings or hearings, and a media release template to engage the media on and around UHC Day. I'll come back to this page briefly as well, as there are some other helpful resources here. The fourth step is to join forces. This focuses on connecting with members of your community, as well as other UHC and human rights advocates, experts, leaders, and health and care workers to encourage peer-to-peer learning and foster collaboration. It provides two tools. The first is the UHC Day Updates series on Substack, which will launch this week and will focus on social participation for UHC. It will also provide updates on new tools such as the customizable graphic I mentioned and a longer video that we're currently developing. And it will also share information about upcoming events. For instance, there's an upcoming capacity building workshop for youth. So we encourage you strongly to sign up for these updates. You can even access last year's series, Get Ready for UHC Day, which provided step-by-step instructions on how to prepare a campaign. So there's a whole slew of resources there that you will find useful in preparing this year's campaign. The second tool in this section is the heat map. I'll click on it here, where you can, it will be developed when we start receiving submissions, but you can fill out this form as of now if you're planning an event, a publication, or an announcement to have it featured on the map. This will help us show the reach of the UHC movement while allowing other advocates in your region to join in on your activities. And finally, there's step 5, share the movement. This section provides additional assets, visual assets, that you can use to amplify the UHC movement. That includes the UHC Day logo in all of the UN languages, as well as profile frames, profile pics, banners, Zoom backgrounds, and a PowerPoint template. We encourage you to use these broadly and generously. By using the same branding, we show decision makers that we're a unified movement and that we all stand together behind the urgent need for health for all. So those are the main steps and tools to engage in this year's campaign. I realize it's a lot of information at once. We're available to answer any questions you may have, but I also want to take a couple of minutes to quickly walk you through the other tabs on the UHC Day site. The resources tab, which you saw quickly earlier, has the templates I mentioned, but it also includes useful advocacy tools, links to global UHC commitments, such as the recent resolutions on health financing and social participation, and the 2023 and 2019 political declarations on UHC. These materials are particularly helpful because throughout the campaign, we're emphasizing that we're not asking for anything new. These are things that countries have already committed to, and we just want them to stay true to their word and put their promises into action. This page will also feature a new Get Inspired section, which is coming soon. And we'll have examples of how other organizations are adapting the UHC Day materials for their own purposes. So if you'd like support with that and you would like to be featured in here, please don't hesitate to contact the Civil Society Engagement Mechanism. Other tabs include the UHC Champions page, which currently still features last year's champions, but will be updated later this year. And the Impact page, where you can access reports from previous campaigns and learn about the impact of the UHC movement. So we hope you'll find these tools helpful and that the slogan and messaging resonate. This is your campaign. We strongly encourage you to pick and choose the tools and messaging that suit your needs and then to make them your own. And please don't hesitate to reach out if we can support you in any way. With that, I'll hand it over to the team, who will share a few examples of videos submitted through the Health Costs Hurt campaign to help you get inspired, to spread the word, and to tell your story. Thank you again.
Great work, Paloma. Let's roll the videos.
I'm a person living with multiple morbidities. That includes NCDs, HIV, mental health conditions, and disabilities. In quest of seeking medical healthcare services, my families and I, we are being driven deep down into claws of poverty and perennial debt. No family should choose between food and medication. When health costs hurt, we speak out for universal health coverage, health for all, leaving no one behind.
I'm Nupur from India and I live with type 1 diabetes. For people living with diabetes and NCDs, health costs hurt. Families often have to choose between medicine and rent, or education, or food. Civil society and people with lived experience need to be at the center of this change. It is people like us who understand the barriers firsthand on the ground, living with it every single day. I have the opportunity to be in New York at the United Nations General Assembly, and I call on member states to strengthen health systems to ensure financial protection for people with non-communicable diseases and mental health conditions, and together, along with civil society, to work together towards universal health coverage. Let's leave no one behind.
In my own personal community, the CAH community, the reality of those costs are clear. Daily medications like hydrocortisone and fludrocortisone aren't optional, but rather a necessity. On top of that, families face regular lab work, endocrinology visits, or emergency room bills during adrenal crisis, and travel expenses to reach specialists who actually understand the condition. These costs add up quickly, and even with insurance, families are often left with high out-of-pocket bills. Some families have to cut back hours at work to care for their child, while others have to spend thousands each year just to cover medications and monitoring that allows their kids to live safely. The number shows the size of the problem, but the lived experiences, they show the weight of it. Missed work, drained savings, hard choices between health and financial stability are some among numerous other problems. Rare disease patients shouldn't have to fight this battle alone. So by sharing our stories, we put a human face behind the statistics and remind leaders of what's at stake. Health is not a privilege reserved for those who can afford it. Health is a universal right.
So you all can see the impact of those voices, and I see represented in the chat as well, the importance of bringing those videos, those stories of people with lived experience, talking about the challenges they're facing in accessing healthcare. We really encourage you to become a part of the Health Costs Hurt campaign. All the information is in the chat. The toolkit is downloadable. The resources in many languages are there, and it's exciting to see some of you already adapting them and posting them on social media. So thanks again, Paloma, for your hard work with the team on developing those resources and for walking us through it. Please feel free to put any questions you have about using or adapting those materials in the chat. You too can have a cool background like ours for your next webinar or your UHC Day events. Now we're going to move to the panel discussion on the importance of financial protection to make progress on health goals. We're very fortunate to be joined by this fantastic panel of advocates and leaders with experience from across health issue areas and regions of the world to share with us a bit about their own experience and advocacy around the importance of financial protection and why it's at the heart of universal health coverage. We'll also hear a little bit from each of them about their plans as we start this lead up to UHC Day. For purposes of facilitating the ISL interpretation, they will only come on screen one by one when it's their turn to speak, but please join me in welcoming all of them. I'll do their brief introductions and bios, excuse me, now, and then we'll get into the conversation. So first we're joined by Allison Cox, who is the Policy Advocacy Director at the NCD Alliance. Allison brings decades of experience in global public health and civil society advocacy with, of course, a strong focus on tackling NCDs and the working at the intersections of NCDs, financial hardship, and of course the importance of addressing NCDs to achieve universal health coverage. Allison, I want to say congratulations to you and the whole NCD Alliance family for leading such impactful advocacy around the recent high-level meeting on NCDs. Our next speaker will be Prita Chakraborty, a core team member and volunteer with Women in Global Health based in India. Prita supports research, partnerships, and chapter development initiatives in India. As an independent consultant, she works at the intersection of gender, health systems, and equity-driven policy. And Prita, UHC 2030 and the CSEM have been so pleased to partner with Women in Global Health on gender-responsive health systems for UHC advocacy. So thank you. Then we'll hear from Jaime Atienza Escona, who is the Director of Equitable Financing at UNAIDS. Jaime is an international expert in financing for UHC and education, with over 2 decades of experience across public institutions, foundations, and global civil society networks, including more than 13 years at Oxfam. Welcome, Jaime, and we really appreciated UNAIDS' focus on equity at our recent UN General Assembly event on UHC. Then we'll hear from Ilse Kalmya, lead for political advocacy at the Partnership for Maternal Newborn Child Health. Ilse is a passionate advocate for women's, children's, and adolescent health and brings extensive experience from her work with the UN Secretary General's Independent Accountability Panel and over a decade at the Global Fund, as well as a background in public service for the government of Latvia. Ilse, kudos to PMNCH on your new strategy, which we were really pleased to see includes an important focus on increased awareness of sexual and reproductive health and rights as an essential component of UHC. Then we'll hear from Kana Halic-Kordic, Vice President for External Affairs at the International Federation of Medical Students Associations, or IFMSA. Kana is here to represent over 1.5 million medical students worldwide, bringing youth perspectives and energy to the movement for UHC and health equity. Congrats to IFMSA on a really powerful statement on health workforce at the recent high-level meeting on NCDs. And finally, Dr. Mingitsu Asnake-Kibret, our Senior Country Director from Pathfinder International, and I'm proud to say an advisory group member for the CSEM. Dr. Mingitsu has led health system strengthening efforts across Ethiopia and beyond, championing primary health care and community-based solutions. Thank you, Mingitsu, for your leadership and advocacy as part of the CSEM advisory group and in your day-to-day work. So thank you all again for being here with me. I'm going to invite Allison now to join me on the screen. Sure we get you there. So Allison, we've been speaking about financial health costs, and we know that NCDs are one of the leading drivers of out-of-pocket health spending worldwide. So I wondered if you can share some of your experience, talk to us about why financial protection is particularly critical for people living with NCDs. We heard a little bit from Newport in the video, how UHC can help to accelerate that progress. And I wonder if you'd also like to share some examples from your work that illustrate this challenge or highlight some of the stories coming out of the high-level meeting on NCDs that bear this out. Over to you.
Thanks a lot, Amy. And yeah, nearly 1/2 of the global population is living with a non-communicable disease like diabetes, cancer, and including mental health and neurological conditions. So NCDs have to be central to any universal health coverage conversation. Also, NCDs are chronic conditions that require long-term or lifelong care. So paying for treatment isn't just a one-off expense, it's ongoing. And on average, globally, out-of-pocket spending for NCDs is estimated to be twice as high per visit to a health facility than for infectious diseases. And that's not a competition, it's just a fact. So for people living with NCDs, financial hardship from health spending is an all too frequent reality. And treatment is only part of the cost. There's also, transportation, childcare, time lost from work, either to visit clinics or care for family members who are living with NCDs. And we heard some of that in the content we've seen already. In 2023, we produced a report called Paying the Price, and I'll put the link in the chat, which included some umbrella reviews exploring the household economic burden of NCDs and these out-of-pocket costs. And their findings really support many of the key messages we've already heard today, showing it showed this wide variation with burdens higher in low and middle income countries and among vulnerable groups such as the elderly. Are we still going? I threw a bit of a pause, but I'll keep going.
Looks good, Alison. Go on.
Okay. People on low incomes, rural residents, and those with chronic conditions, all facing a higher burden. And this financial burden has consequences. It leads to income loss, sometimes choosing to stop the treatment, reducing spending on other essentials, including on education for the family members, borrowing and reliance on community support alongside mental distress and social stigma. So you mentioned the recent UN high-level meeting on NCDs and mental health, and we were really pleased to see the focus on the delivery of prevention, diagnosis and care through primary health care that was included in the negotiated declaration that was negotiated ahead of the high-level meeting. And that included a target for access to affordable medicines and products, along with a target for financial protection against unaffordable health costs. Because for health conditions, NCDs, all health conditions, these universal health coverage basics are critical to addressing health inequities and creating healthier populations. And of course, if we're talking to other ministries, supporting the economy. So you asked about case studies, and I'm just going to bring one lived experience example. And it's from Michael Uchenor from Delta State in Nigeria. And he shared his story as one of our Views Our Voices NCD diarists. And I'm going to share the link because he tells his story much better than I do. But basically, his story really illustrates everything that we're talking about. He suffered from a stroke that left him unable to speak, move, or walk. Recovery took him a long time, over 2.5 years. And the financial burden of treatment and medications were overwhelming. Paying for not just medications, but physiotherapy, speech therapy, exercise, and healthier food all took a heavy toll. And his stories, he talks about the wider costs of that, not just immediate care, but also emotional costs and the feeling of stigma and isolation in his community. But his story is one of resilience and hope. He set up a foundation that's now providing support to others, and he's also an advocate. He's calling for compassionate and inclusive action, and he's calling on policymakers to deliver funding for comprehensive care program, along with training for healthcare professionals and adequate numbers of professionals, community awareness around prevention and treatment, and providing rehabilitation and support. So please do look at his case study, and we are certainly getting behind this launch and look forward to hearing from the other panelists. Thank you.
Thanks so much, Alison. And I think those words from the case study calling for compassionate and inclusive action and focusing on resilience are so crucial to the advocacy that we have to take forward in this challenging time. Thanks for sharing that story and also for highlighting that really shocking piece of data that the healthcare costs for NCDs are twice as high as for communicable diseases, really highlighting the importance of the intersections between the work on NCDs and UHC and the primary healthcare approach. Thanks for sharing the stories, which will also help to amplify during the campaign time here in the chat. Now I'd like to invite Prita to join me on the screen from Women in Global Health. And thanks to my colleagues for doing all the tech and the spotlighting in the back. Hi, Prita, we've got you. Thanks for joining us. We know that women and girls are often disproportionately affected by out-of-pocket health costs, both as patients and as healthcare workers. And we have had some questions and comments in the chat relating to the healthcare workforce. I wonder if you could share some stories, some experiences from your work in India, illustrating the gendered impact of inadequate financial protection and highlighting the importance of the gender responsive approach to UHC, which we've worked on together. Over to you.
Hi, Amy. Thanks for the question. In our work at Women in Global Health India, we often speak about how women are positioned both as providers and recipients of care, yet remain at the margins of how health systems are designed and financed. Is my internet lagging? I can start up again.
No, you're fine.
Okay.
Unfortunately, our
Okay.
ISL interpreters are having some
Okay.
lag, but they're catching up and yours is very clear. And I think the other interpretation is fine. So let's keep going.
Okay, thanks. So I'd like to share a story about an accredited social health activist, an ASHA worker, who's a community health worker employed by the Ministry of Health and Family Welfare as part of India's National Rural Health Mission. An ASHA worker working voluntarily travels several kilometers each day, often on foot, to reach distant villages. She is responsible for ensuring that pregnant women receive antenatal checkups, that immunizations are delivered on time, and that awareness around hygiene and nutrition continues even in the remotest of communities. But here's the paradox. The ASHA worker herself has no financial protection. She spends out of her own pocket for transport, waits months for honorarium payments, and when she falls sick, she delays seeking care because even a small expense can set her back financially. Her story reflects a larger pattern we observed through our secondary qualitative analysis of 36 studies on gender and India's universal health coverage journey. Across the literature, we found that women face higher unmet healthcare needs and catastrophic out-of-pocket cost, not just as patients but as healthcare workers. Poor women are 4 times more likely than men never to seek treatment, and even non-poor women are twice as likely to delay or avoid care. The same gendered barriers extend to the health workforce, predominantly women. Community health workers like ASHAs and auxiliary nurse midwives face systemic undervaluation, irregular pay, and unsafe working conditions. One of the studies we reviewed noted that women are underrepresented in higher value insurance claims, which means even when they are covered by government schemes, they are less likely to access specialized or costly care. The gender gap is reinforced by social norms, limited mobility, lack of decision making, and time poverty due to unpaid care work, all of which reduce women's ability to prioritize their own health. And these are not just numbers, they reveal a systemic bias in how we conceptualize universal health coverage. If women's health needs, particularly sexual and reproductive health, or the realities of the women delivering care are excluded, then UHC is neither universal nor equitable. That's why when we launched the gender responsive UHC narrative in July, it wasn't just a communication campaign. It was a call to reimagine what universality truly means. The narrative emphasizes that gender equity must be built into the design of health financing, data systems, and workplace policies. It's about shifting from gender neutral to gender responsive approaches, where women are not only beneficiaries but decision makers shaping the system itself. Going forward, we need disaggregated data that reveals whose needs remain invisible. We also need to recognize and formally compensate women health workers and expand essential service packages beyond maternal health to include comprehensive reproductive and chronic care. An ASHA worker story like this one and countless others like hers remind us that achieving UHC by 2030 will depend not only on expanding coverage, but on embedding equity and gender justice at its very core.
But what powerful research, in all of the recent high-level discussions of addressing universal health coverage and NCDs just recently, this emphasis on the health workforce is there. ASHA health volunteers have no financial protection themselves. What a powerful finding and also an unjust way of working. And thank you for emphasizing that there's no universal and universal health coverage if women's health needs are excluded, not universal, not equitable. Encourage everybody to check out the joint work on UHC and gender responsive health systems, which we'll also share in the chat. Now I'd like to invite Jaime to join me on the screen. Jaime, thank you for being here. From UNAIDS, we've heard a bit about the specific impacts on populations living with NCDs. We've heard about particularly gendered aspects of lack of financial protection. I wonder if you can speak a bit about how out-of-pocket costs affect access to HIV treatment and care, especially in low-resource settings, and some recommendations about how we might address those challenges. Thanks for being here.
Well, Amy and colleagues, it's a real pleasure for me to join you today, and I want to express UNAIDS' full support to the UHC 2030 campaign, to all the work that you're presenting today that is so essential to move ahead with. We cannot have access to the right to health if we don't advance and fight and go ahead for universal health coverage. So let me start there, and let me also say that the equity approach is part of what UNAIDS brings forward when we always speak about how to connect the HIV response with the health systems and with universal health coverage. So that was the first point I wanted to make, full support and equity as the key element. To your question on out-of-pocket payments, the reality that we have had in the recent past is that in the HIV response, out-of-pocket payments have been less intense than in other sectors. So as much as we've had that strong burden on people on their health challenges, HIV, possibly because of its financing model, it has been relying on a number. Oh, sorry, is my sound not getting through?
You're fine. You're fine.
Oh, okay,
There's
because
some
I see.
delays. No, there's some delays in the I think the ISL connection, but we're fine. And I think keep going.
Okay, I keep going. This was my second point, just saying out-of-pocket payments has not been such a profound problem in the past because the financing mix of the HIV response counted on a very strong global solidarity, and the large donors involved in the HIV response would be paying for the most expensive part, that are the medicines in the system. So that was not normally the big problem. And international donors, to give you a number, used to pay 60% of the HIV response in African countries. But the third point is that we are really in an entire new world today. As you all know, the development assistance for health is really shaking. We cannot have consolidated numbers, but the fall is very steep, and that happens especially for HIV because it was so dependent for low-income countries on donor resources. So we are in an entirely new environment where protecting people from out-of-pocket payments, from being excluded from health insurance schemes or from other instruments under development is going to be critical. I think the other thing is to say that this could be my fourth point, that because these are the circumstances and because the HIV response moved from its emergency stage into a more stable stage, although not yet in epidemic control, as you well know, this has been the time where countries have been preparing for a transformed HIV response that is more integrated into primary healthcare and into universal healthcare. Countries are taking very clear steps. The troubles, of course, are multiple because it's not that there are very strong systems to hold the HIV response on top of all the other things, and systems that were already underfunded. So funding, as you are saying, out-of-pocket payments is a big thing, but funding is also an extremely relevant challenge for health systems and for the right to health that is being defended here. And the challenge and probably the solution is to go towards increased domestic revenue mobilization, to include commitments to eliminate out-of-pocket payments. As an economist in health financing, you always talk about where are the financing flows coming from, and you know very well in low-income settings, the first financing flow is ordinary people, and that is completely unacceptable going forward. For the HIV response and people living with HIV, their troubles are more on the side of, we could say, stigma and discrimination that has already been mentioned, lack of easy access or directly human rights challenges to key and vulnerable populations that need to be specially treated. And this takes me to my final point, that is really speaking about communities and how communities have played and need to continue playing a leading role in the HIV response and in this universal health coverage that has a solid place for people living with HIV or people that are vulnerable to it. The leadership of communities has been essential in advocacy, in services, and in being the voice of people and putting forward with strength what needs to be done. I want to mention as an example, because you were asking for some example, how the global network of people living with HIV that brings together a number of entities in different countries were the ones to convene what they called a meeting of leaders of people living with HIV that are leaders in their countries, in their communities, to see what are the responses that need to be given. So besides the shock of the cut of funds, moving ahead to lead and to be part of that new response, transformed response, and sustainable HIV response within the universal health coverage and a stronger health system. I will stop here. And again, thanks. And it's a real pleasure to be with you.
Thanks, Jaime, for touching on so many of the important points that we're discussing today. That community leadership, community is also at the center of demanding and shaping how a health system serves them. I think we've put a lot of focus in our campaigning on the crucial role of social participation, and we certainly learned a lot from the HIV movement about how to do that. I also appreciated what you said when we're talking about financing flows and domestic resource mobilization, that the first financing flow is ordinary people, and that's unacceptable. Thank you also for linking to the conversations on stigma and the human rights challenges. When we talk about leaving no one behind, we mean it. It's not universal, as we heard already from Pritha, if certain populations and large groups of people are left out of the promise of UHC. So thank you for those remarks. Continuing on with the panel, I'm going to invite Ilse to join us on screen. And remember, if you have questions about the toolkit, about what our panelists are sharing, please continue to pop those in the chat. We are collecting those for the discussion. So Ilse, the Partnership for Maternal Newborn Child Health has for a long time highlighted the importance of equity in your work on maternal, newborn, child, and adolescent health. We heard a little bit about it already from Pritha, but I wonder if you could talk about inadequate financial protection, and in particular, how that is impacting women, children, and adolescents, and what reforms you and PMNC see as being most urgent. Over to you.
Thank you so much, Amy, and such a pleasure to be here today. And huge thanks to the UHC colleagues, because indeed, despite all of the crises and recent pandemics and issues, health we don't see is prioritized to the extent it's needed. And for us as the PMNCH, as was said, the largest alliance working on the women's, children's, and adolescent health, it is critical that every woman and every child and every adolescent everywhere can not only survive, but also thrive. And unfortunately, we see that's not the case. And one statistics to start with, I would like to say, is that there are still more than 700 women dying every day, either during the pregnancy or in childbirth. And it is every 2 minutes. a woman dying from preventable causes. And what we are seeing now is that those numbers are in some contexts going up. And this is something that we discussed about the equity and the health. It's when the woman is dying, this is the future mother of the baby. She may have additional other children, wife or a partner, a sister, a friend, a colleague, a family member, a society member. So it's not a health issue only. It's truly a tragedy for a society. And for very many women, the costs associated with pregnancy and childbirth, especially if you face complications, are a huge out-of-pocket expenditure. And as several colleagues mentioned, we are living in multiple crisis situation, and the abrupt funding cuts which we faced earlier this year and which are ongoing creates additional pressure. And what some of the evidence is pointing us to is that there is an estimated 14 million additional preventable deaths leading to the 2030, and more than 4.5 million of these would be the children under age of 5. And this is something that all the hard work we all have been working together should really not be stopped and should be doubled down, because we are facing great risks. And specifically, the cost remains a key barrier to the equity as well. As it was mentioned, when we are looking at the woman, they are also the ones who are most often are caring for elderly, the children, those who need support. And very, very oftentimes, they are neglecting seeking their own health care. And also, as they are not available, having the same resources as others. And here I want to mention also adolescent girls in particular, because they do face double vulnerability, and namely their limited autonomy over the health spending and very restricted access to sexual and reproductive services and also commodities, something that, again, we are facing quite a considerable pushback, especially recently. One piece of evidence, what we are learning from the recent report from the Commission of Investing in Health, is that they found that the cutting the risk of dying before age of 70 in half by 2050 is achievable by prioritizing 15 conditions, 8 of which relate to maternal, newborn, and child health. The Commission also argued that the essential services should be funded by domestic resources and prioritized within the national health plans. It's why, indeed, as it was said, it's the key time to call on our leaders. And as the PMNCH, we are also supporting the Global Leaders Network, which is the network of sitting heads of the states, because health is a priority for the whole of the government and cannot be just put on the shoulders of the health ministries and health community. And it is more than an investment. It is truly as investment in driving economic productivity, stability, and also prosperity. And I also would like to end us with a message of courage, because we are seeing a lot of work and inspiring examples, as it was also mentioned, in the countries and communities, and seeing how through strong partnerships, as one of the steps in the campaign, joining the forces, civil society, highest level political leadership, young people, healthcare professionals, and also linking very much to media, we can raise awareness, we can accelerate efforts, and we can ensure that these budgets and policies do help to improve the lives and livelihoods. And health is a fundamental element for this. So thank you so much, and very much looking forward to continuing working with all of you on the UHC campaign. Over.
Thanks, Ilse. Thanks for your partnership and also for lifting up so many important points. I swear I did not write the talking points for all of our panelists. They are making these fantastic connections to the campaign messages. I wanted to say also congratulations on the launch of the Global Leaders Network. The theme for UHC Day last year, as you may recall, was health. It's on the government. And that's not only, as you said, on the Ministry of Health, but crucially on ministries of finance and the highest levels of government to prioritize access to universal health coverage for all populations, but we've heard the particular impact for women, children, and adolescents. People are sharing personal stories. I delivered my daughter by a C-section, and here in the United States, I received a hospital bill for almost $50,000. Fortunately, the majority of that was covered by my insurance, but it resonated with me what you were saying, Ilse, that so many women are facing extraordinary costs for the process of having a safe and healthy childbirth that protects them and their children. So this is a space where we need to continue the advocacy. I also appreciated you mentioning adolescents, because it's a great introduction to our next speaker. Maybe not only adolescents, our medical students, our young adults, but thinking about the role of young people. So I want to invite Kana to join me on the screen. From IFMSA, it's also important to have the voices of not only young people, but also healthcare professionals joining us on the call today. So kind of, young people and medical students often see firsthand some of these barriers that we're talking about today, the barriers that the communities they're serving face in accessing healthcare, whether that's about cost or it's about the stigma that we've heard for other speakers. So from your perspective, how do out-of-pocket costs undermine access for young people and vulnerable groups? And talk a bit about how you've been mobilizing young advocates to lead this advocacy on financial protection. Thank you.
Thank you so much, Amy, for your question. It's really a pleasure to be here, as you mentioned, not only to represent the perspectives of future healthcare professionals, but as well youth. So the fact is that actually 1 in 3 young people globally lack access to essential healthcare services. And something that we as medical students and future healthcare professionals who are working within healthcare systems are witnessing on daily basis is how mostly financial barriers can very easily translate directly into health inequities. Especially if you're discussing the perspective of out-of-pocket costs, which are one of the most visible and damaging obstacles to achieving universal health coverage. For young people, the reality is that we are often very financially dependent. So we are either going through schooling or we have unstable jobs. So even a small fee can deter us from seeking care early. So something that's a cough that could have been easily treated, unfortunately can progress in more severe condition. And in that perspective, the issue is not just the delay in healthcare, but also a situation where young people and especially vulnerable groups are put in a very challenging positions. So when I say young people, I'm especially referring to those who are coming from low-income families as well. So they have to decide either whether they will choose to pay and cover for their healthcare or they will cover for some other essentials like food, rent, and education. And in this kind of situation, the issue is that health becomes a privilege and not a human right, which is very, very dangerous. As you mentioned before, I'm here representing International Federation of Medical Student Associations, which gathers over 1.5 million medical students from over 120 countries. So our work on this topic is both focused on international level. For example, last year we renewed our policy document on this topic, but we also have our national member organizations working on various activities. There is a very nice initiative for medical students in Egypt that every year they conduct a national campaign to raise awareness on universal health coverage. But it's also a topic that we discuss when we meet in our annual meetings. And as mentioned, we're a very diverse group of students coming from different backgrounds. But the sad reality is that even though we're from all over the world, we hear the same story when it comes to universal health coverage reality, but in different contexts. Especially when we are talking about young people in rural areas, migrants, or for example, young people coming from conflict-affected communities. These are groups that are often excluded from healthcare services, not because they don't value them, but because they cannot afford them. And unfortunately, the services that are mostly affected are the ones that young people need the most, but are also services that are usually not covered under the umbrella of services that are publicly funded. And these, for example, include mental health services, sexual and reproductive health services, and as well sometimes management of some chronic conditions. Another issue or outcome that we have from here is that, as mentioned, out-of-pocket costs do not just delay access to healthcare, but they also decrease the trust that young people and vulnerable groups also have in health systems. So when care is something that we cannot afford, young people tend to turn to some alternatives that are often not regulated and can be very, very, very dangerous. And to follow up on your second question, as you mentioned, to address this challenge, we can say, it's important to have everyone involved, as well as youth. And some of the examples of good practice that I can share when it comes to mobilizing youth to be advocates, because youth, they would love to engage, and they would love to bring solutions to the table. So I would say the most important aspect of it is that young people are capacitated. So it's important to raise awareness about the issues and also support them when it comes to building knowledge. Because young people, especially the ones coming from vulnerable groups, often feel excluded. They don't feel they're competent enough to raise their voices. They don't feel empowered enough, often because of the even like technical language that's present in this topic of health financing. So these kind of initiatives, like this campaign, and then different workshops, webinars, peer-to-peer initiatives can really help young people to get confidence. So when it comes to them engaging with policymakers, they're seen as equal partners and not just beneficiaries. Another important aspect is also something that we in IFMSA work a lot on, is creating spaces for shared narratives, so young people can connect with each other and also exchange their experiences. Another also important aspect that I believe this initiative is, once again, a really wonderful example of, our partnerships and collaborations. So it's really important for young people, especially youth coming from vulnerable groups, to be able to engage with different partners from civil society and policymakers. So collaboration that IFMSA has with UHC 2030, as mentioned, I think it's a very nice example of that. And last but not least, I would say even the most important aspect of empowering youth to take a lead in this process is to ensure that their participation is meaningful. Often we can see that young people are being engaged, but often just as a tokens in consultations. So it's really important to provide spaces where young people can meaningfully contribute to the process, whether they will be working on national planning or they will be part of global forums. For example, I think also some examples of good practice happened this year when a lot of young people were actually engaged in review of SDG 3. Because in the end, young people are not only the ones who are experiencing these barriers firsthand, but they're also ones who can bring a very innovative solution to the table.
Thanks, Kana, and thanks again for bringing out so many of the points we talked about, addressing inclusion and helping through campaigns like this to make sure that young people have the messages and the understanding of their rights, the information to claim their rights, and to hold their countries accountable for supporting their healthcare. There are a lot of questions in the chat about data, and we are going to talk about that in a moment. You also mentioned trust, building trust with health systems. I often share the quote from WHO Director General Tedros, who said that health is one of the most important trust is one of the most important commodities in health. So thinking about how we build those trusted relationships and ensure that young people can seek all the care they need without unnecessary barriers like parental consent, for example. It's a lot of important work. Thanks also for highlighting that 1 in 3 young people lack access to healthcare services. I hadn't heard that statistic. It's staggering, and obviously something that requires our advocacy in the lead up to this UHC Day. So thank you. I want to invite our last panelist, Dr. Mingitsu, to join me on the screen. Mingitsu, we know that you do a lot of work directing communities in Ethiopia and other places that you've been working. And I wonder if you're able to share a bit with us about what financial hardship from health costs looks like in those communities that you serve. What's the role of NGOs, civil society partners in holding governments accountable to their UHC and financial protection commitments? Over to you.
Thank you, Amy, for giving me this opportunity in this very important panel. And I'll try to give briefly the example from Ethiopia. Over the past 2 decades, there were several strides in ensuring primary health care, in improving health inequities in Ethiopia. And our health extension program and community-oriented delivery platforms brought vital health service closer to millions of Ethiopians. Unfortunately, financial hardship remains one of the greatest barriers to universal health coverage in Ethiopia as any other countries. While there has been a systematic expansion of access, too many families in Ethiopia continue to experience financial catastrophes when they get sick. The most recent national health accounts show that out-of-pocket spending is roughly 1/3 of the total health expenditure. Estimates also show that about 1 in 20 households will experience catastrophic health spending. For the poor households, this often involves a trade-off of collateral, such as selling their livestock or removing children from school, or relying on predatory interest rates to secure payment for those extra costs in the healthcare. This burden is likely more severe for women, rural households, or the informal sector, who primarily remain outside of the formal insurance system and who have limited access to financial protection against risk. Despite this challenge, Ethiopia has making steady progress towards financial protection. The introduction of the community-based health insurance has now been scaled up to all woredas or equivalent districts nationwide, with about 60% of the eligible households enrolled into this insurance mechanism. Evidence shows from this insured families are more likely to seek timely care and less likely to face catastrophic expenses. This is clearly demonstrating the potential to break the link between ill health and poverty. In parallel, there is also a preparation well underway to launch a social health insurance scheme for employees in the formal sector. So the long-term vision to integrate the community-based health insurance and the social health insurance into unified national health insurance system, which one that promotes solidarity across income groups and ensures that no one is left behind to inability to pay. Well, when we come to the civil society organizations and also advocates, I think this is key. The advocacy part is the key piece of this journey. And civil society organizations and development partners have an important role to play in holding leaders accountable in their universal health coverage and financial protection pledges. Well, we probably need to come together in a coordinated manner. Sometimes doing these things individually might not have an outcome which we wanted. So there should be a joint message should narrowly focused and aligned on three most important things. First of all, expanding financial protection for the poorest and the most vulnerable. Again, increasing domestic investment and innovative financing in primary healthcare and essential health services, and ensuring accountability and transparency of universal health coverage implementation, which can be the major areas where advocacy and civil society groups can work into that. By doing this, we really need to make like no family should have to face poverty as a consequence of accessing healthcare, and financial protection is not simply a matter of technical issue, and it's a matter of morality. Thank you, Amy. Over to you.
Thanks, Mangitsu, and what a great way to wrap up the panel. No family should face poverty in order to access healthcare, and it is a moral issue that we're discussing. Thank you for sharing those experiences from your work on the ground and also highlighting the importance of accountability. There's one question, just in the interest of time, we've been collecting your questions and sort of compiling them together. There have been some questions about the importance of data, how we track accountability, how we look at the commitments that have been made for UHC in the past. And I want to invite our co-chair, Pam, back to the platform to talk about some other exciting resources that will be launched around the time of UHC Day, which is new accountability reporting on UHC commitments. Pam, can I ask you to talk a little bit about Act for UHC?
Yeah, thanks, Amy, and thanks for the question. So we know that accountability is probably one of the key pillars of demonstrating progress, as well as being able to continue the momentum around striving for UHC by 2030, which again, we know is still an ambitious goal. So the UHC 2030 has developed a report that the data are being collected right now as countries are being asked to give us information about how they are in fact meeting their commitments to the political declaration from 2023 on universal health coverage. So we know that again, accountability is one of the three pillars of our strategic plan right now in terms of what UHC 2030 needs to contribute to looking at the progress that's being made, not only just on the UHC indicators, but the action plan that UHC 2030 developed a while ago. This includes where are countries in terms of political leadership, making sure we're addressing leaving no one behind. Are we modernizing laws and regulations? And that includes, again, provisions for insurance schemes and health coverage. We know that the health and care workforce is an essential ingredient. That's numbers as well as education and scope of practice. We also are looking for greater investment, whether it's reinvestment, whether it's changing the mix in terms of where monies are coming from, or as we've mentioned, creating the opportunity for new revenue through health harming taxes. Collaboration between public and private sector. Much of the discussion in the health architecture and financing landscape is to look at how there can be more domestic resources, but how do we maintain that collaboration? We also know that gender equity, which you heard from several of our panelists, is critically important because women are more disadvantaged, not only in receiving care, but in all of the effects of not receiving care, of not being able to afford care. And then certainly health security is then the fundamental umbrella that if we are in fact taking care of people, we can strengthen our economies and communities. And so the dashboard is focused on looking at countries reporting so that we'll have country profiles as well as looking at global penetration of how countries are achieving UHC. Some of the reporting in the past has, even though it is all voluntary as this will be, has not been as robust or given us as much detail to understand the progress. So we are making sure that by the end of this year, we will have the first draft of the data that we'll be able to share. That will help target where some countries need help or where toolkits can be deployed to really understand how every country can work on their commitments to UHC.
Thanks, Pam. And my colleagues have dropped the website into the chat where you can look at the previous year's accountability data and where the new Act for UHC data will be launched around Universal Health Coverage Day. So we do encourage you to look at that evidence from your country and use it in your advocacy. In the interest of time, we won't be able to have wrapping up comments from all of our panelists, but I am going to invite the panelists to please let us know in the chat. I wanted to give you time to share your stories, which I think were so powerful. But please, panelists, give us a highlight in the chat of one priority action that you and your coalition are highlighting for leaders to take now to protect people from catastrophic health costs. And thanks to those of you who've already shared links to your resources and websites in the chat. Now, to bring this all together, I want to invite our other UHC 2030 co-chair, Dr. Magda Roballo, to join me on screen to give us the closing remarks. Magda is the Executive Director ad interim at Women for Global Health, one of our co-chairs. Over to you, Magda. Thanks for being here.
Thank you, Hami, for such a fabulous moderation, and thank you to our panelists for insightful contributions. We had a diverse group of panelists from different backgrounds, and I've really enjoyed listening to you. So we have reached the final end of this launch, and it is my pleasure to join you to conclude with some remarks and look forward to a very successful and vibrant campaign for Universal Health Coverage 2025. Again, I thank our panelists for such a great discussion. As they articulated, strengthening financial protection and removing the barriers individuals face to accessing health services and products is necessary to realize people's right to health, to make progress on the Sustainable Development Goals, to boost economies and strengthen equity and social cohesion. Listening to the panel speakers shows how universal health coverage brings us all under one umbrella, moving beyond disease-specific silos, build people-centered health systems that improve the health of women, children, adolescents, strengthen HIV/AIDS and STD responses, reduce inequalities. Every speaker mentioned about the inequalities in global health, support people living with chronic conditions, and protect populations in emergencies and conflict settings to truly ensure no one is left behind. I also wanted to emphasize that at the heart of universal health coverage are individuals. Behind the numbers, we have families, we have communities, and the health workers who care for them. Ensuring access to quality care without financial hardship is critical to protecting health and protecting dignity. When care is unaffordable, people delay treatments, risk longer-term illnesses, and place additional strain on social support systems. This is particularly true for women and girls who are often disproportionately affected, facing additional barriers to accessing care and bearing the social and economic consequences of these gaps. Through my work, I've met women in communities who experience these impacts every single day. Having been a minister of health, one of the most painful moments for me was when people would knock on my door, request for appointments to see me, just to show me the prescription that they have received and they cannot afford to pay. Women came to my office as Minister of Health with last stage breast cancer, asking for support. And you can't imagine what that is for a minister leading a health system that you know is failing people every single day. So this is why governments must listen to their communities, to civil society, and especially those most affected by impoverishing health costs to ensure health systems meet the real needs of people. Meaningful social participation is therefore essential, and advocates play a critical role in providing a platform for these lived experiences and amplifying these voices. When governments invest in universal health coverage and protect people from impoverishing health costs, they also drive significant economic and social benefits. For each year of life expectancy gain, GDP rises by nearly 4%. For every $1 invested, the return is $9. By investing in publicly funded financial protection schemes that guarantee everyone has access to a set of essential health services, governments avoid short, medium, and long-term costs in health spending. They reduce welfare losses, they increase household savings, and overall economic prosperity. So for the UHC Day, my call to action, together with the broader community and my co-chair, Pam, we are calling on governments to act decisively to make UHC inclusive on financial protection and, most importantly, a national priority. We are also calling for adopting and implementing laws to protect people from unaffordable health costs. We are calling for budgets for an affordable package of essential health services. We are calling for strengthening publicly funded health schemes to cover costs for the entire population. We are calling for the elimination of health costs for those most in need. And we are calling for making everyone's voice count when shaping our health systems. So from now through UHC Day on December 12th and beyond, we encourage you to use the tools and the resources presented today, deliver statements and write letters to your decision makers, mobilize the media, unite with one strong voice for UHC so that by 2030, everyone, everywhere is protected from impoverishing health costs and can access the quality health services they need when they need them and where they need them. It's time to tell governments loud and clear, we are sick of it. Unaffordable health costs are unacceptable. We are sick of it, and we demand action to ensure everyone can access the care they need without facing financial hardship. I thank you.
Well, I could not have said it better myself, Magda. All the applause and celebration for that summary, those call to actions. And I dare say that we need more ministers of health like you in the world. We appreciate we appreciate your leadership. Thanks again to you and Pam and to all of our partners in UHC 2030 for raising these important calls to action. As we're preparing to wrap up here today, we're going to leave you with just a few key activities. Again, there are so many resources and ideas in the chat. Thank you to our panelists also for putting their calls to action there in the chat. To keep the momentum going, we encourage you to share the UHC Day campaign messages and visuals. I see some of you are already doing it on a couple of social media platforms. Post your health cost hurts video. Let us know where your UHC Day plans are happening so that we can get you on the heat map and publicize it. Use the toolkit. It is downloadable, as my colleagues put in the chat. Sign up for our Substack, which gives you links to practical tips, literally step-by-step tips on how to do a campaign. And stay tuned for other webinars and activities, including capacity building workshops that we have coming up. I hope you'll join me in thanking all of our speakers today and our French and Spanish interpreters. And thank you to our International Sign Language interpreters. Thanks to all of you for your time and for your passion, for being a part of this family of advocates who are willing to stand up and say, we don't accept unaffordable health costs. As Magda said, we're sick of it. As Mingitsu noted, we are here to work on this moral imperative of achieving health for all. Please do reach out to us at UHC 2030, at the Civil Society Engagement Mechanism, and at all the coalitions that you heard from today, if we can better support your advocacy as we lead up to Universal Health Coverage Day. The resources are live now. You don't have to wait for December 12th. So let me be the first in wishing you all a happy UHC Day a little bit early. Thanks again to the team behind the scenes for a fantastic, smooth webinar. And we look forward to seeing you on a future UHC Day conversation. Thanks again.